I don't know if you all get finance journals, I get medical journals, and she calls them my nerd comics when they come through the door. And on a Friday morning, actually, we normally have something in our department called Journal Club where we discuss, the articles and she heard me talking about that one time. She says, "Oh, Daddy, you're going to Nerd Club this morning." I haven't told her what we're doing here today, so I'll say that till later. But question for you, how many of you in your organisations have got a deficit?
Massive one. We did have a week ago,
I
bet my deficit's bigger than yours.
Leicester, we have a £40 million deficit, but the thing that I'm slightly smug about is my understanding is Nottingham have got a £60 million deficit, so they're in a worse position than us. So, and that probably leads me really to my first point, is that as a doctor, I'm really competitive, as clearly all you are as well with that race just there. But we're really competitive, and we all want the best services for our patients, and actually there is also another edge that we want to do better than the other lot, actually, and that's really true. So really all clinicians want to be better than the other people around them, as well as delivering the best service they can, and that's something that you all can tap into, because we are really competitive. So one of the reasons I got interested in finance in my own trust is exactly that. And again, I'll give you some examples of how finance is important to me today now. So I do a few things in my line of work. I work in the intensive care unit, and recently we had a CQC inspection that said that around the hospital, we're a 3-site trust, we've got 3 hospitals, and they said that we've got lots of high dependency beds scattered all over the board. I don't know if any of this relates with any of you in those places you work. And they were saying that these HDU areas, these high dependency areas, charging a tariff for their patients, and they're not really getting HDU care, and that's not really very good. And therefore you need to come up with a solution, and the solutions are either we make these HDU areas proper HDU areas with the right staffing, or we bring all that work into the intensive care unit, which will mean doubling the size of our intensive care units. But whatever model you pick, that's going to include finance, and that's going to include a lot of modelling. So that's one area. Another one of my areas is something called interstitial lung disease within respiratory medicine, and that's going to become an NHS commissioned service. And so recently, last year sometime, we filled in some specs, and we didn't hear anything for the longest time. And then last month we got a letter from our local area team saying, can you deliver against these specs? We said, and then I put a return in for that. But the point is, I've now got to be aware of actually what are the commissioning issues around that. So actually I also know that there's going to be no money with this specialised commissioning work as far as I'm aware. We might get a small tariff for seeing outpatients from Kettering General Hospital, but that'll be it. We'll be doing a lot of the work. So actually be a loss leader probably, frankly. So do we want to compete to become a specialised centre or not? Obviously it enhances our reputation, but in terms of pounds and pence, I'm not sure it'll make much of a difference. So that's another area. Lung cancer, one of my areas within lung cancer is tobacco, so I do a lot of work with respect to our smoking cessation services in our trust. And again, at the moment, I'm trying to persuade my trust to invest in our smoking cessation services, because actually, in terms of return on investment, it's a no-brainer. It's one of the cheapest cost per quality that you can do as an intervention in medicine. So really, the point I'm trying to make is that with every single element of the work that I do on a day-to-day basis, there is a commissioning, a finance facet, and I'm one of 600 consultants in my particular trust, and I can tell you each one of those will be involved in something that involves commissioning. Now, one of the reasons I got involved with finance is because I also run sort of management days, if you like, for both trainees and consultants, and we did these, and we put a session in on finance this was kind of just before the new changes that came in last year, you know, with the renaming everything, although everything's still the same. So we were trying to explain to our trainees and our consultants, you know, what the new changes were. And within those sessions, we also had sessions on things like, you know, complaints handling and getting to the coroners and stress management and all these sort of non-clinical things. But this session that got the best feedback was the finance session. And so we thought about that and looked at that a bit more and thought, why is that? And what became apparent to us is that none of the clinicians know anything about how finance works. And at a very basic level, what people want to know is, where does the money come in from and where does it go? And I suppose ultimately what they're asking is, how can I then influence some of that travel, some of that money to support the services that I'm working on? And that's what they wanted. So as a result of that, me and the Deputy Director of Finance, who's at UHL, we put together a workshop. And this was a half-day workshop that we hold in our hospital. And we looked at the stuff we presented in just a 1 hour slot on this management day, and we expanded it to a whole morning or a whole afternoon. And we covered NHS finance as relates to UHL, theory of PLIX. We had a practical PLIX session where all the people could look at their own PLIX data together with their own individual logins. And we had a session on budget statement reading and how to write a business case. And we managed to fit that into a half-day session, a 3.5 hour session, if you like. And it was completely voluntary. Nobody had to do it. You know, and we've had 200 people come through, which for something that's voluntary, I can tell you, and these are consultants who are a pretty cynical bunch usually, they came, they wanted to come, and we had a waiting list every time we put on, and we did it in small groups, we did 20 in a group, but that format really worked because they got to ask specific questions about their own services. They could ask Simon, who, as I say, is the Deputy Director of Finance. He knows how the system works. Because we led it together, a clinician and a finance person, it had this sort of the credibility of both. And Simon brought along some of his other finance colleagues who he works with day to day, so that they could actually hear the questions that the clinicians were asking. And what was interesting for us is that you get this barrage of questions and almost a bit of hostility about, you know, why is this so? It's so unfair. Why are these readmission penalties? Why can't I do that? Why do I have to do this? But by the end of it, they're actually in an entirely different place in terms of understanding what the goalposts are, where money does come from, what are the rules that we have to play by, and how they can be helped by finance. So that's sort of what we've been doing, and we've done the same with our SPRs. How many of you used the HFMA Financial Engagement Survey? Is anybody aware of it, actually? Let me ask you that. Is anybody aware there's an HMFA survey on financial engagement? Okay, there is. And so we took that survey and we administered it to everybody who came to our workshop. So we've got 200 consultants in our trust who've now done this survey. And the survey goes through, you know, what do you think the importance of finance is? What about the clinical input? How have you been involved in finance? What do you think are the enablers? What do you think are the barriers? And so we have that information, and actually it's free for you to all use this HFNA survey. So we do that with each session. So we now know in our trust what the medical folks anyway want from the finance department. So in some ways we've done our 360 appraisal within our trust using that survey. And all sorts of things come up actually. You know, they want finance surgeries, if you like, drop-in surgery, they want shadowing opportunities, you know, there's all sorts of things they want. We're going to, as a result of these sessions, we're going to change our PLIX database so that some of the non-bed holding specialities like anaesthetics or radiology clicks information becomes more useful to them. So it's been a really useful exercise. And so really, in some ways, what I think today in the FF, the Future Focused Finance, is about how can we improve clinical partnership in your areas of work. I mean, we've done what we've done, and that seems to have worked for us, and we're going to do other things, hopefully. But it might be entirely different to a CCG or an ambulance trust or another acute trust or another sector. So really, the question for you today to think about is what can we do in your areas of work. So from the kind of pre-engagement work, some things came from that, and this is talking to, again, your finance colleagues, clinicians, other people, and you'll see there's stuff on 360 feedback involving patients and business partnering. So I think with this session, what we wanted to do is start with sort of a question. The first question is going to be about the 360 feedback.